2010 was a very challenging year, a year characterized by what I call the wall of worry. Investors were worried that Medco's best years were behind it. They worried we might lose our largest client, United Health, or that the generic wave was soon to end. Maybe gross margin growth is gone forever in a world of aggressive pricing. Well, we wouldn't accept that.
Medco Health Solutions. That's right, MHS. A despised, totally misunderstood stock that's down an astounding 28% year to date.
Fortunately, Medco's share price has been punished by fears that the company is fighting a pricing war, which could hurt margins.
So you can see the wall of worry builds and builds. The wall of worry crumbles.
I'm encouraged here, and I feel that we're tearing down the wall of worry.
Medco Health Solutions, some positive comments about its business, says it will renew about $18 billion of business next year.
This great growth, this strong growth, has led to meaningful appreciation of our stock for shareholders.
The healthcare landscape shifted in 2010 with healthcare reform. The debate continues because expanding access to coverage on its own is not sustainable. Real healthcare reform must also address quality and cost. So Medco's mission to make medicine smarter and more sustainable took on a new urgency in 2010.
The way I describe healthcare reform is it's really a three-legged stool. The three legs of the stool are access, cost, and quality.
Can America, the wealthiest nation on earth, do what every other advanced nation does, which is make sure that every person here can get adequate health care coverage?
We have to do something to change the system that we have. The present system is directed and run and driven by the insurance industry.
So we continue to grow because the clients look to us as part of the solution to the burden of healthcare costs.
And right now, frankly, there are 30 million people who don't have health insurance at all. There are a whole bunch of people who aren't added to that list who all they have is a catastrophic plan.
But we also know the burden of cost related to health care is astronomical and unsustainable.
If we think it's important as a society to not leave people out, then we're going to have to figure out how to pay for it.
The reform bill we have today is almost entirely about access. There's very little in the bill that gets at cost and quality. If we don't get at cost and quality, the stool is going to fall over.
In 2010, Medco extended smarter medicine on multiple fronts. We helped refine our treatment protocols and we enhanced patient safety with breakthrough studies on how genetics affects warfarin dosing, on mammogram compliance, and medication use amongst children, to name just a few studies. We also advanced our capabilities in personalized medicine and post-approval drug research with the acquisitions of DNA Direct and UBC. With these 2010 advancements, Medco is truly making medicine smarter.
Doctors can now look at someone's DNA to personalize the dose of the popular blood thinner Coumadin, which is used by millions of Americans. It's an important new tool because the medicine can be dangerous if someone is prescribed too much or too little.
In this past year, we published the final findings of our collaboration with the Mayo Clinic, where we demonstrated a 30% reduction in hospitalizations between those who were tested versus those who were not.
Doctor, give me the news.
We thought we would find a much higher compliance with mammography.
Dr. Milena Subar and colleagues found just over half of women in the age group most at risk for the disease, those between the ages of 50 and 64, were screened once a year.
Medco's report found spending on drugs for kids rose nearly 11% the most of any age group.
Pharmacy benefits manager Medco Health Solutions of Franklin Lake says it's completed its $730 million acquisition of United Biosource. That's a firm that helps companies run studies of drugs and medical devices.
In 2005, we launched DNA Direct, and we've been providing web-enabled medical information around genetics and services related to it, including facilitating testing for specific medical conditions.
In 2010, we moved the concept of an agile enterprise from paper to practice. Every day we're devising new ways to do business. We have to. Our clients and members demand it, and you demand it. We began to realize a vision to transform the core of our company, equipping our people to work better and more collaboratively. This involves replacing major systems and deploying new technologies and organizations so we can develop and deliver with greater speed and precision.
It's a beautiful day. Sky falls, you feel like it's a beautiful day.
There is an explosion of new tools from mobile apps out there. The way that the phones are built now, they've created an architecture that developers all over the world can basically create small applications, make them available on the phone. It is a way that the world is communicating and engaging with businesses now. We see that as a huge opportunity to get in at the beginning of this transformation and become an industry leader in that space.
This year we're going to be collaborating actually with our client Verizon to build game-changing mobile apps. When the doctor tells me it's time to start on Lipitor, I'll be able to just key in the drug, hit a button, and within 30 seconds or so, up will pop a customized list of the clinically appropriate alternatives with all of the prices that I would pay based on my specific plan design. A Medco member is going to be the only one in the country who's going to be able to initiate that kind of dialogue with their physician right in the exam room and get the right script written at the right time before they ever leave.
Pega then is a very open, easy to use tool set that allows us to do things in minutes and hours instead of months and weeks or sometimes years with high reliability, high performance.
The nice thing about the Pega system is it organizes, it prioritizes, and it allows us to assess the patient's information so that it gives a more quality call.
We're upgrading our whole core infrastructure, and the upgrade is driven around patient-centric versus claim-centric.
It's just a way to provide that overall view and that overall picture of the patient to really give, again, a better quality of life. And at the end of the day, that's what's most important.
What Apple did when they built their iPhone, they created the thing that truly has revolutionized this space in an enormous way. They created that service bus in those frameworks as part of their Apple technology so that any application developer in the world can actually write an application that can run on that phone. So what the BIAX jobs are is to become the app store of Medco. That's what they're doing.
A BIAC is a Business Innovation and Agility Center, and it's a combined group of IT professionals and business professionals integrated into one team that works for the business.
That mixture is magical in terms of bringing relevant solutions to market and really keeping the individuals involved in that effort engaged and enthused about what they're doing.
The BIACs are the engine to help pull this company directionally with its strategy to be able to be the leader in innovation.
Making medicine smarter is a complex business. It's about things like data, precision medicine, and reducing healthcare costs. But at the end of the day, it's about people. It's about a mother who lives to see her child graduate. It's about a little girl with diabetes who plays and laughs and lights up her family's life. It's about a patient on warfarin who gets the right dose and lives. Smarter medicine is about living. And what you've done and the way you've worked together in 2010 brought life to many and brought Medco to life.
You're simply the
Reaching out to patients has been most rewarding to me because I can make a difference, one person at a time.
Macy loves life. She wants to play. She wants to be with her friends, and it's not easy. Having a great support system for Macy is critical. It's important to me to have better solutions, better technology to make her diabetic care easier.
It just makes you feel really good at the end of the day when you go home and know you've helped so many people.
And I believe Medco is blessed with incredibly talented people very deep in our organization.
I think Andrew was 12. He took a different challenge in his sickness. We go to the Hemophilia Center. They introduced us to Accredo after we were buying the medicine from there. We had a nurse that was very good to Andrew at the time, and she came out and taught him how to infuse himself. He was only 12 years old and he was determined to learn.
I'd like to say thank you to Credo for being there, for calling us, for helping us. They're the best at what they do.
I'm always excited when they say to me, thank you for calling, thank you for caring. I didn't know that Medco had this service, and I really appreciate it.
We're seeing the highest client satisfaction levels that we've ever seen in the history of the company. And I have to tell you, that is something that we're really proud of.
I'm very proud to say we are the first and the only national PDP that's ever earned the 5-star rating of excellence from CMS.
Not only are you the most admired company overall for your industry, you're number one in innovation, use of corporate assets, quality of management, financial soundness, quality of products and services.
I love my job at Medco because I can speak to patients and give them one-on-one, undivided attention.
I don't know if you really understand how much good you do for America. Being able to deliver services the way it's done here, remarkably. It's a miracle.
2010 was a roller coaster at times, but in the end, it was a year worthy of pride and celebration. We closed 2.3 million gaps in care, delivered nearly $3.7 billion in generic savings, and saw continued strong sales and client retention rates. We drove technical breakthroughs and research discoveries that benefit patients, clients, and the practice of medicine worldwide. We also laid down a solid growth strategy for the next 10 years. We established Medco Silesia BV, our European joint venture, which will help drive lower costs and better quality of life beyond our border. That's pretty inspiring. We ended the year with the winds at our back and on course to achieve a new decade of continuing growth. Medco has a bright future because we're making medicine smarter, more precise, more cost-effective, and sustainable. Medco is in the right place at the right time, and so are you.
I can see for miles and miles. I can see for miles and